For many, coronavirus is a news item, where several are skeptical and many more live in denial. Today, we'll bring you up close with victims and those who look after them in the fight for Nigeria's future. A sound that doctors have become all too familiar with at this isolation center at the National Hospital in Abuja. Since the first case of the novel coronavirus was reported in Nigeria, the numbers have continued to rise.
For all suspected COVID patients, we have the isolation holding area where they are admitted, and we keep them there until the result is out, all right? While they are there, we have doctors who are taking care of them as well as nurses 24 hours a day, and their job is to make sure that these patients survive for the result to come out, which may be in 24 to 48 hours. When the result is out and it's negative, the patient is moved from the treatment holding area to the hospital. We have currently about 230 patients on admission and they do not have COVID. But those that their results show that they have COVID are moved to the COVID treatment center itself. Another group of patients that we admit are those who already have a COVID positive result, and these patients are admitted directly to the treatment center.
Once confirmed that a patient has the virus, treatment commences. The isolation centers are categorized according to the severity of the symptoms presented.
We do not take patients who are mild, so we depend on referrals because the FCT epidemiology team as well as NCDC, who have access to results, alert us immediately, as well as other treatment centers who have very severe cases. So they will call us and tell us that they have a patient and want to know if we have space, because like I said, we have a limited space. We are also able to give ICU care with ventilators. So we don't want a patient that is so severely ill to come in an ambulance and wait here when they're all oxygen dependent. So when we are informed that there's a patient that needs transfer to our facility, we make sure we prepare the bed and the staff to receive the patient. And when they arrive here, they're escorted to the treatment center or directed to the treatment center where they're picked at the entrance and taken up immediately. There are three levels of isolation centers, all right? There are some centers where you would see that the patients, like in Abuja, you have the IDU. The IDU treatment center is a level 1, and a level 1 is one in which the patients are mild. So they just take patients that are either asymptomatic, but they are positive because their family members were positive and they were tested, and they don't really have severe symptoms. They don't need oxygen, for instance, but they need to be kept away from other members of society so they don't spread it for at least 10 to 14 days. Then you have the level 2 center where they would treat mild to moderate cases, like the Asokoro treatment center. But the level 3 in Abuja are National Hospital, University of Abuja Teaching Hospital, as well as the recently opened Dome. So these are the centers where it's possible for patients who are very sick, who have comorbidities and need to be managed by experts. They need 24-hour monitoring, oxygen as well, and if they need intubation, it's available. Because some of these patients deteriorate very fast, it's important that they are classified into mild, moderate, and severe, and then they get the best chance of not dying.
The National Hospital is a Category 3 isolation center where confirmed cases who are diagnosed with severe symptoms are admitted. The clinicians start by testing to ascertain the immediate help they need.
A typical day for me is that I resume at work and I get to the isolation center and I have a brief meeting with the staff. We do a recap, a review of the things that happened the preceding day, and then we talk about challenges and we have our work plan. We identify those patients that need further attention, critical care, or who appear not to be doing well. And we tend to focus more on those patients, really. And after doing that, we don and go inside the isolation the ward itself, and we can be there in that uniform, in the PPE for close to 1 hour, 2 hours, sorting out patients. So by the time we come out, we're drenched. One of the things we discover is that at times, because we deal with very critically ill patients, okay, by the time you're leaving a particular patient and you've gone to see the other one, you receive a call that this person still needs your attention. And so you need to do the necessary things again, go back to see that patient, and it could be quite tasking. And you can imagine after spending like an hour or so in the ward, or even more on the ward, taking care of patients, after doffing, you receive another call that a patient is deteriorating, and you still need to go back inside and to look at what is happening. It's really quite tough, that's the truth, but we've been trying our best.
This is the entrance to the holding area where we keep suspected cases. So when a patient arrives at the emergency room and they suspect, based on the criteria that I used, they suspect that this could be a case of COVID, but not confirmed yet, we bring them here. Now this used to be our inpatient pediatric ward that we had to close down for the purpose of this assignment.
Absolutely.
Relatives are not allowed beyond this point here. In fact, we don't allow relatives to come into this place at all. But the number of the patients that come here are suspected patients turn positive eventually.
Although this is a Category 3 isolation center for severe cases, there are different stages of recovery. And so, life goes on. Friendships are formed.
The good thing is, all the patients here now became like a family. Everybody has one story to tell. We got to know each other. We probably made friends here for life. And I must say, Nigerians are very caring. When you are in the same boat together, I still have to ask my neighbor, how are you doing? You see, that camaraderie, that we are going to get out of this together, that human spirit that cannot be broken, that's what keeps us together. There's a man from India here, I've never met him before. In the other room, we became friends. There's so many other people here I've never met before, but something brought us together, and we're fighting it together. So please, people out there, this thing is real. Please stay safe and stay blessed.
All shows that COVID-19 is not a death sentence, especially when confirmed on time. For these ones, the stories are not so different. They underestimated the virus and wished it away.
Oh, God. God, I'm better now. I'm better. I'm okay.
I was on oxygen for almost a week, and for the past 5 days now I've removed it and I've been lively, so everything has been okay.
So confirming that COVID-19 is not a death sentence?
It's not a death sentence, but the major problem is that majority of people are not aware that it's real. So that's why we have to appeal with the media to step up the game of the campaign that indeed you don't know your next neighbor's status. And it's so fast that if not for God, it takes few acts and it sweeps you off your feet. But we give glory to God that some of us that passed through it, we are alive to test the testimony. All we need to do is that people should be aware that it's real and it's very, very close to you. So you have to follow all the precautions given by the government, wash your hand, use your nose mask.
You see, this Nigeria is not my portion thing. Do you understand what I'm trying to tell you? In quote, our religion, be Muslim or Christian, that it is not my portion. Trust me, COVID-19 is no respecter of anybody. If you are rich, you are poor, you are handsome, you are ugly, you are fat, you are thin, this virus doesn't care. So that denial that, oh, I don't want to get tested, it's not my portion. Nobody decides for it to be his portion. Unfortunately, if it gets you, if you don't handle it in time, they'll come and chop rice in your burial.
Sincerely, I didn't believe it too until they brought my results and said, I gave them a hard time. But then, the thing is, even if everybody comes out, I tell them my day, my face. There is not something you will want to accept onto your family member, because I know how much my family members are going through just because I'm here and what I have been through. So I don't wish for anybody to go through this, but it's not something that if you just see it, you will believe it's true. But then I've seen people cases that is worse than mine. I'm one of those people that, as lucky, they didn't put me on oxygen. They didn't have to move me around. So I just that's it.
However, sometimes lives are lost.
We've treated so many patients, but we've lost a number of patients, including some people who are very close to me. I have lost a close friend. I have lost a senior colleague, in the society that people know very well. I have also lost a brother that was particularly close to me, and we grew up together. So this disease is very real, and it is more devastating when people are on the elderly side. They have comorbidity, what we call comorbidity. They have other diseases in their body that they have been battling with, such as hypertension, such as diabetes. And if their immunity is low for any reason, maybe nutritional, maybe another disease brings down their immunity, they become susceptible.
It has been very tasking seeing an adult gasping for breath. I can't breathe. And you're there, you've done all you know how to do. The person is still there. And we've actually lost some patients too. So, I don't want anybody to go through this. So I please want to appeal to the beloved people of Nigeria to please listen to the government, listen to what the Presidential Task Force has been saying on a daily basis. I know that I see you on TV most of the time. I know that they should please obey. COVID is real.
Some deaths occur even before arriving at the hospital. Once confirmed that the cause of death is the deadly virus, family members are tested. And while some refuse to be tested, there are others who reject the result if positive.
Our challenge of convincing relations of patients when their patient dies in the holding area that in fact the result is positive, because our responsibility is to call to notify them as part of contact tracing. So for instance, the patient is brought and the patient dies within a day or within a few hours. We ensure that sample is collected on these suspected cases before death, sometimes after death. We treat the corpse by decontaminating it, putting it in a body bag and sending it to a separate part of a mortuary until the result is out. When the result is negative, we call the relations and release the body to them for burial. However, if we find that the result is positive, we also call the relations, notify them that they need to be tested as well to protect them and their family members. 50% of the time, the family is willing to do the test. The other 50% of the time, they start arguing with us that it's not true, that their relation does not have COVID and we should release the body to them.
Health authorities are warning that cases of the coronavirus will continue to increase as the country is now in the community transmission phase, where 76% of confirmed cases cannot ascertain how, where, and when they contracted the virus.
I'm aware that there's a community infection stage now. By way of hindsight now, I believe I may have come in contact with one or two persons who at that time themselves may not have been aware that they were infected. But I tell you, it just takes a little slip, a little mistake. COVID doesn't forgive. All it needs is one opportunity, and it will bring you down.
Before now, I believed, of course, but I just felt it was one thing that was something in the background till I realized I had it. Then I came here and I have seen a lot of people pass away. And it's real. It's real. We are so many of us are here. Now I'm beginning to hear people tell me, oh, I had it too. But when I got into isolation, like there's this stigma, so everybody's just hiding until they get to hear, okay, you have it. Then they now tell you, yes, I had it too. That's why you couldn't reach me for this period. A lot of people are living with the virus.
To make matters difficult, symptoms of the coronavirus are similar to symptoms of malaria, which is endemic in Nigeria.
Well, it started as like the everyday normal malaria, but it progressed to be more than what it was. If you know yourself and you know your body, you know that after 3 days of treating malaria, it wasn't working. If I can explain this, you have like 1,000 elements attacking you all at once. You're cold, you're hot, you're throwing up, you're stooling, your system is breaking down, you're struggling, you can't get your breath. In short, you're just fighting for your life.
I've been treating malaria for like about 5 days. I wasn't getting any better. I kept on getting weaker and weaker and weaker. I had to take a couple of days off work. Then I woke up one night and just used the bathroom, and I almost passed out. I couldn't breathe. Nothing was going in again. I couldn't eat. I couldn't do anything. And just at that point, I realized, okay, it might just be corona.
Classic malaria symptoms. And then I treated for malaria and it didn't go. So I felt maybe it was a fake malaria medicine. So I tried again. By this time, I started having joint pains. I started having insomnia as well. I was having the feeling of feeling very cold. I eventually started suffering from shortness of breath. That was the point where I realized that it's getting really bad. I couldn't support myself very well. And I knew that COVID-19 was surely an option. It was surely a possibility here. So I got in touch with my doctor, who made the arrangements for me to take the test, which I did. The test took a little while to come out, but even as at the time the test had come out, I was sure with the symptoms I had exhibited that it was most likely COVID-19.
Being treated for malaria for like a week. I was on injection for drugs 3 days, injection 3 days, and I was getting worse. So I was referred from the hospital I was to this place. I couldn't smell, I couldn't taste, I couldn't eat. I had to just drink pap, but I'm better. Sincerely, I didn't believe it too until they brought my results and said, I gave them a hard time. But the thing is, even if everybody comes out, I tell them my day, my face, there is not something you will want to accept onto your family member, because I know how much my family members are going through just because I'm here and what I have been through. So I don't wish for anybody to go through this, but it's not something that if you just see it, you will believe it's true. But then I've seen people cases that is worse than mine. I'm one of those people that, as lucky, they didn't put me on oxygen. They didn't have to move me around.
Believing it can be managed, most people start their treatment from home. Unfortunately, they unknowingly spread it to those around them, especially the elderly and those with underlying diseases.
For most people who have COVID-19, it is not a death sentence. But we know that worldwide, people are dying in hundreds of thousands now worldwide. But the range is from 1 to 5% in most countries, which means that if 100 people have COVID, 1 to 5 people will die. In Nigeria, we are seeing 2-point-something%. But we don't like to talk in percentage. We don't like to talk in statistics. We don't like to talk in numbers when it comes to human life. The one person is a breadwinner to a family. So for that family, it is not 1%, it is 100%. It's not a 1 in 10. They've lost their breadwinner. So COVID is real and people are dying. The people who are in their prime, in their 60s, they have made it, or they are close to making it. They are the breadwinner, the head of their family, at a time when their family needs them the most.
From just one case at the outbreak of the disease in Nigeria on the 27th of February 2020, at the end of July, the number has climbed to over 42,000 cases with over 800 fatalities. At the beginning of the pandemic, medical workers were referred to as the frontline responders, but that has since changed.
A healthcare worker infection amongst our staff is higher amongst those who are taking care of normal patients. Yes, in 4 months, only one staff that is taking care of COVID patient has been positive. However, in the same period, more than 20 staff, actually 21 as I speak, have been managed and discharged from our own treatment facility, but none of these were taking care of COVID patients. So the truth about COVID is the fact that unless we have a test that we can get a result instantly, we still do get patients who walk in through our doors who are COVID positive, undetected.
Is this something we should allow to happen? No. Some of those deaths can be prevented if people arrive early, if they suspect immediately they have symptoms, rather than saying that it may be malaria, it may be typhoid, it may just be ordinary cough, and start self-medication. It is proper that they immediately seek attention in a hospital. That is the key. When you seek attention in a hospital, the doctor and the health workers there are able to have what we call an index of suspicion, which will quickly make them to say, you need to do a COVID test. And even before the result is out, they will start you on treatment. Yes, they can treat you for malaria, by which time they are expecting the result to be out. And if in 3 days the result is out and it's COVID, then of course the treatment is directed properly. And we have found that when people arrive early, when they have high index of suspicion, and we treat them early, the mortality rate will reduce.
Nevertheless, at the forefront of managing the pandemic are medical workers who sometimes don't see their families for weeks or even months.
We've been here, yeah, but we don't go home every day. We have a place where we stay. At the end of the duty, we go there. We take our bath, then go there, stay. Maybe at the end of the week, you just go briefly, then you come back.
That we encourage each other. Apart from that, for the 1 or 2 that needed, we've actually had colleagues who broke down, and after that period of work in that place, and they needed psychologist review and psychiatrist review, and we had to call them to review them. And of course, after that, we had to tell them to stay off the work. COVID doesn't have legs. The virus doesn't have legs. It is human beings that carry this virus everywhere. And I think the advice is for people to please stay safe, stay indoors as much as you can, avoid gatherings, follow all the things that the government has said we should adopt. Safe practices should be adopted, really. Physical distancing, please wear your face mask. Please, we still see people, and I think that is a challenge. At times when I have chance to drive around town just to pick 1 or 2 things, I see people without face masks in groups, and you wonder, in spite of all that has been said, some people still don't want to obey this. And I think it's nice to please tell it on the mountains that people should please protect themselves.
These frontline health workers are the heroes in the fight for Nigeria's future.
So now you can see that the beds are widely spaced.
Around the world, vaccines are being tested at different stages. But until one is given the all clear, victory lies in the adherence to the non-pharmaceutical solutions, which are the wearing of a face mask, practicing social distancing, washing the hands for at least 20 seconds under running water, and of course, protecting the elderly.